Hey, well, welcome to Medical Sales U. This is the podcast where we explore innovation, leadership, and also reinvention in the healthcare space. I'm your host, Dave Sterrett. And today's guest it has an exciting perspective and an interesting perspective to share with us. Dr. Kevin Maggisano is a physician in Canada. He has an MBA. He has a background in both family medicine and in surgery. But what I think was fascinating is many of you who've been following my podcast, you know a little bit about my story. I was a religion and philosophy major. That at the age of 35, I decided, you know what, I want to reinvent myself. You know, I was in the nonprofit sector. I was a teacher. I actually had a private school making less than public school teachers. And I was doing, humanitarian trips to places like Africa. And I thought at the age of 35, if I want to get married someday, have a family, be a great provider, I want to reinvent myself. So I went into medical device and now in specialty pharmaceutical. But our guest, Dr. Kevin Maggisano, is a very intelligent man. He has the degrees. But what I respect about him is he's always learning. And we are just very fortunate, Dr. Kevin Maggisano, to have you on the podcast. So welcome to Medical Sales U.
Thank you.
Well, Kevin, I appreciate that you came to us. This program we started, we were coaching, some younger people who were trying to break into medical device, pharma, trying to get jobs. And then we started getting educated nurses, nurse practitioners, pharmacists. We have doctors of physical therapy. And then you reach out to me, medical doctor with an MBA from the Johns Hopkins University. You have a lot of experience, a lot of business experience as well. But I'm just curious, what inspired you to even reach out to me on Medical Sales U and reach out that first time?
Yeah, well, I'm 38. I've been in practice 10 years. I love the learning process. I think that's me. And I just wanted to shift into business roles. It's tough in your late 30s to do so, but it's sort of the time I have probably 10, 20 years of good work ahead of me. So I wanted to try to shift into business, and it's never easy to do so. Plus, I was moving from Canada to Miami, so it was doubly difficult. I didn't really have a network there, and I just needed all the help I could get. I had already had a coach I found from the university, so your program just fit the bill. It was perfect.
Well, I appreciate you reaching out to me, and I think you add a lot. And I think the thing about it, our program, is just the relationships and the different perspectives. I think you had a story where you learned a lot. There, you were in the operating room, surgery, and there was a rep one time. I think you shared with me a story that actually provided some good insights during the surgery procedure. Do you remember that story? Could you share just a little bit about that?
Of course, especially orthopedics, where the operations require a lot of different tools and setups, and often the surgeons and the nurses just are not very familiar with it. Very good at the patient care, of course. So, for example, last week, I was with a surgeon who was putting in a fibular nail. Never done it before, but because we had an excellent rep there, we were able to do it without a second thought. So the reps, the medical people in the device side, the business side, can really help with patient care, especially those roles.
That's just an encouragement to all that are in our program, and those who are, wondering, can I make a difference? Can I help a physician? I don't have the degrees. I don't have, I have a bachelor's degree, and that's an extraordinary insight there. If you're trying to break into medical device or pharmaceutical sales, or maybe you're ready to reinvent yourself into a new specialty like oncology, our program, Medical Sales U, can help.
I just want to say that I'm extremely grateful for Dave Sterrett and his program, Medical Sales U, which allowed me to transition from a clinical role into a rewarding career in sales.
He even taught me how to negotiate my sign-on bonus. I'm now making $60,000 more than I was as a pharmacist.
Our members come from every background: nurses, pharmacists, teachers, athletes, and they're breaking in fast, averaging $151,875 in 11 and a half weeks. Many are earning over $200K. The industry is changing lives. You can change lives. Check us out, Medical Sales U, Invest in yourself, and let's get you in the game. Kevin, can you walk us back to the early years? You live in Canada now. You've also spent some time in Miami, but can you go back to the beginning, your childhood, growing up, and I believe both of your parents were physicians as well.
Yeah, my dad is a surgeon. My mom was a nurse anesthetist. Interestingly, they met in Texas when he was doing his fellowship. So I had the privilege of seeing healthcare, what it was like at a young age. I got to meet his mentors, some of these old school surgeons, cut from a different cloth sort of thing. Definitely influenced my educational journey. But I have a more technical mindset. That's just the way my mind is. And I always knew I wanted to do something beyond medicine. I mean, not to take away from the profession. I always wanted a little more of a technical role. And, but the issue is once you get into the medical field, you invest heavily to get into it. I think any way you get into it. So it's hard to get out of it because you've invested so much. The business end of things just helps me bridge the gap into more of a technical role.
Wow, that was great. So, man, the education that you earned your 4-year bachelor's, right? Is that correct? In Canada, and then you went to medical school, correct? And you mentioned 38. You're a young man, 30. Young man. And what was that like going back to Johns Hopkins to get an MBA degree? What inspired you to decide to do that?
I mean, it just made sense for me at the time. So many different things personally, in my personal life too. It was just timing. It was great. It was not an executive MBA, so it felt a lot like, an undergraduate degree. So it was a grind just like then, which was fine. It was my time in life to do so. It made sense. But, at the end of the day, I got the degree and I feel it was the right move for me. It's obviously I paid a huge opportunity cost to get it. It was just the right move for me.
What was the hardest thing? You've gone through a lot of education, and there's just so much you have to juggle as a physician. What was the hardest part of your education in going through medical school?
Well, once you get your profession, once you get your role, once you get earning your paycheck, for example, let's say, you get a job through medical sales, you're earning a lot of money, and now you're able to live your life, build your family. It's very hard to get off. It's very hard to leave that once things start to click in your personal life, especially if you're building a family. So going back and investing in learning is very destructive because you're not earning income, you're missing out. It's tough. Not only is it tough, we're getting older, and our minds are just we're more driven on adult things. As we usually associate learning with what we did when we were younger. So the hardest thing is getting back into the habit of learning. Except it's so crucial because we're built. It just helps us in so many ways. So the biggest pearl, honestly, from the MBA was not really what I learned in the MBA. I took the opportunity to start to learn a lot of things about personal development, and those lessons really, because I was already committing the time to education, I had the facility to do so. The additional investment I put into learning about personal development has helped me tremendously.
What are, you have a level, I think physicians have a level of concentration and discipline and grit, right? Because we have so many distractions around us, just like, all the time. And it takes a lot of discipline just to stay focused, to learn, memorize something that maybe naturally you're not passion. It's not like your number one passion, but you just grind out and get it done. But then you talk about personal development, and those were some of the things that helped you along the way. I look at a guy like you and look at all your education. I'm like, well, what does he need with personal development? For you personally, what were some things that you thought, these are some areas in which I can grow? And what were some of those things that you were being challenged in personal development?
Well, it would most definitely have to do with relationships. And I was about to get married. It didn't work out. And that's very tough. I think we're all human. doesn't matter how cool you are as a person, what titles you have. We're all built for relationships. And so that really drove me to dig deep and start to learn, what went wrong? How can I fix it for the next time? For sure, in medicine, what gives doctors and nurses their strength is putting the patient first. You can marshal, just like a mother and father, you can marshal so many resources and extra energy when you're putting something ahead of yourself in the medical practice. It's easy. We put the patient first. And that's why we're able to get up at 3 a.m. and do a procedure, for example. I think the same could be said of a mother and father raising a child, for example. That's one of the key lessons from that can join the twos. When there's something you're doing something for more than yourself, you're going to succeed a lot more than what you think you can.
I love your coachability and just your we all have we go through relationships. We can look back. I can look back in my life, and we all have those moments. Like I can remember being your age and 38, not married, and you go through breakups. There's been times in which jobs don't work out. There's been times in which people that I invested my life with and poured into, and then the relationship failed. And yet all of us as humans, we need to keep growing and being adaptable and realizing that this is not all it. You mentioned 10 to 20 years. I think you have way more than that. What's exciting about your future and with all of us is that we can reinvent ourselves. You look at the stories of the great entrepreneurs. Many of them didn't start their businesses, whether it's Ray Kroc or the founder of KFC or, these stories that we hear over and over, even Sam Walton with Walmart, is that they went through failure and challenges, and then they were able to find success. And I think in life, I say that, sometimes we don't know what God is doing in these moments, but it's teaching us to persevere and learn and grow. And that's why I appreciate you even joining our program at Medical Sales U. And so I thought you have insights to share with us too, because I think sometimes people are like, I just want to do it on my own. And they call me and they want free advice and they want to do it on their own. And then a year later, they're in the same spot. And I'm just like, we all have blind spots, but we need community. We need guidance. We need coaches. And it's not that one coach is going to give all the answers, but it's someone who can help guide us along the way. You've observed a lot in business. And I think sometimes we can learn from other people's mistakes. You've noticed the whole relationship between physicians and money. And sometimes it's good, but sometimes it's not so good, right? And I thought maybe you could just share a little bit about why do you think it's important for physicians and really anyone in healthcare to understand business, communication, selling, and basically relationships as well. So we're talking about business, but also why is it important for physicians and healthcare professionals to understand this?
Yeah, it's a great question. I think medicine traditionally, it's a role that attracts a very hardworking student. More often than not, yet education is a tool for someone to escape poverty, maybe a family, or to grow as a family. Education, it's pretty much the tool most people go to for good reason. What happens, I find, is that then you have physicians that have earned, they've earned their way up. And so they're learning about money. Most physicians are now treating money as something they've come into, and there's a certain learning process to it. I think we're, obviously we're trained to put the patient first and be wary of reps that might sell us on one thing or other. And, we're trained to put the patient first. Where I think business education come in, and even at sales education, is when you view money, less of as a precious resource and more of a tool, more of something communal that we use to achieve a communal goal, then the study of business can be a virtuous thing that we can take towards healthcare. And something like a sales rep doesn't have to be associated with a negative connotation. It could be, a critical piece of the puzzle for patients too.
I like that because sometimes sales reps get a bad rap. Like, what are you trying to sell me? And truthfully, there is an agenda, right? But we're all, to some extent, have our own biases and perspectives and agendas in which we're trying to, accomplish. But I think that to give people the benefit of the doubt and say, look, maybe there's some value that this person can bring to me as well. What about your vision for the future? When we think about your future and some goals, you've experienced a lot of things, entrepreneurship, primary care, you've had your own practice. Where do you tell us a little bit about your vision for your future?
Yeah, I mean, I went down to Miami. I have family down there, and initially I was gonna get a rep job. I was gonna try to apply and get a role at a Medtronic or a device, particularly because I had experience in the operating room. As time unfolded down in Miami, I put the work in, and I took your program. It was excellent. I'll cherish all those lessons and the resources I have from it. But it just, it didn't make sense for me to push harder for those roles. It does take some work to get in. It's not a free ride. Even with the right tools, you have to bust your ass, and what you teach your students is all the right things to get in the door. Just timing for me in my life. I think it's just, as I reflect on where I want to go in my career, I have the circumstance maybe to open a small business, maybe a clinic or two. It would be a perfect kind of business ownership role for me if I owned medical clinics, for example. It's not a popular business to own. The margins are not very good. But for someone with my experience, it's kind of a great fit. So for my vision, I'm going to look into that. If I can own, a chunk of clinics and run them, it's going to be hard work, but it'll be, right up my alley. We'll see how it goes. I'm going to go evaluate that maybe in a week or two and in the new year. But time moves on. If it's not working, if I'm not closing in on a deal, I got to call time on that and do something else. So we'll see how this winter goes. It's going to be crucial for me.
I love that. You talked about winter in Canada. Do you miss that Miami weather?
Well, I learned my lesson in Miami. I learned the Miami way. So what I did in Canada is I sold my house and I got a lake view house. Now I have the view of the water. I learned my lesson. The view is important, just like in Miami. Wow. So now when I go home, I look over the bay. And that's not how I was raised. I was raised, treat real estate differently. Treat your house, as a blah blah blah. So now I got the Miami situation up in Toronto as well.
Beautiful view in Toronto. That's I like that. That's great. So you live in Toronto right now, right? Do you still have a place in Miami, or did you sell that?
I rent in both cities.
Oh, okay. That's great. Two great cities, and it was fun always to hear about your, you jump on the calls. I'm like, where's Kevin? Is he calling from Canada or is he calling from Miami? And that's that's a fun story there. Two great cities. I think with our program with Medical Sales U is like, your story, I appreciate you jumping into our program. And I think there's been a number of people here. We've had, in the last few months, 18 people land jobs. There's been a handful of them still searching. They're still in the process. Some have gotten discouraged because they've gone through like 3 and 4 interviews and gotten nowhere. There's others who've gotten like only to the first and second interviews. There's a handful that have kind of gotten, and they're like, I don't know if this is for me. There's been a few people who don't have any sales experience and they took jobs at like ADP. Others decided, like one guy decided to take a job at a large pharma company, but outside of sales. Like he's like, I want to be in research. And so I just appreciate you jumping in our program in the community as well. When you think about that person who wants to grow, that person who, we have some veterans in our program, but we also have some people who are maybe mid-20s. They want to grow. They're not sure where they're going. What advice would you share with them?
Yeah, I got some great advice because I can relate to them. I'm a free thinker. I like to grow. I like to learn. The issue with being a free thinker, the issue with that is sometimes you just have to follow the program. So I have a story for you that'll help. So I finished my medical training, my medical school, obviously I was keen to learn. I read all the books. When it came to write the board exams, the passing, I treated it like an academic test. I still studied, but I didn't pass the first time. I didn't pass the second time. The only time I passed was when I did programs similar to yours and just learned it had to put the work in and deliver exactly what the test takers wanted. This didn't reflect on my clinical skill or my intelligence. It was just, these are institutional tests. They want to see that this person can deliver exactly what's required. And it does take work to prepare for it. So that's exactly how I see your program. I think you're giving your students all the correct advice. And this is going to be hard for free thinking types or people who are intelligent and are used to their own creative approach to things. Sometimes you have to grind and just do exactly what is required to get in the door. It's exactly how your program goes. You give step-by-step coaching. It's very direct. And I think for creative types like myself, it's going to be unnatural. And yet my advice for them is do it, because at the end of the day, you have this beautiful job. Once you have your job, that's an excellent job, then you can add your creative touch to it. Then you can go on your life. You can do your, add your creativity to it. But there are certain rites of passage, and this is one of them. So that's my advice to them. Sometimes you have to grind to get in the door. And sometimes you're handed the answer, you just have to take it. And I think that's exactly what your program delivers.
I love that. And that's helpful for me too, because like you, I'm a creative and I always have all these new ideas. And it's easier for me to want to wander over and start something new rather than finish it. Like this medical sales U course. I'm on paid paternity leave, and I'm having to dress up, come into the studio, crank this out so that in 2026, by the time you're listening to this, I've cranked this all out. Now, by the time you're listening to this, I'm probably not in the studio. I'm probably going into an oncologist's office, talking to a doctor. But it's the systems. And during this whole time of paternity leave, I'm thinking, what about this thing? Or what about this? And I think that's great advice for all of us. But at the same time, being a creative, sometimes you have to test things out. You have to explore, because you never know unless you try. Now, let's just keep this a little bit fun here. When you're not studying, when you're not studying and you're not practicing and working, tell us a little bit about, Kevin, what you do for fun.
I've had way too many hobbies in my life. I've done everything. I used to ride a motorcycle. What else did I do?
Motorcycle?
I used to. Yeah, I got rid of it. Too expensive. Once I learned business skills, I couldn't justify paying the insurance. So nowadays it's just I try to get in shape. Running. I definitely have the creative streak. So I just built myself like a workout station out of like lumber. So I was like right in my living room. I could wake up. I have my dumbbells right there.
You built it?
It's just a basic wooden box thing, but it's, nice wood and this and that. So now I wake up, there's no excuse for missing a workout. I can't make up a reason, this or that. I got to get it because it's right there. So I guess that's sort of my hobby now, is trying to get in shape. But the diet gets me though. I definitely do not have that.
What type of food gets you? Maggisano, is it Italian? What type of food gets you?
For sure, the Italian stuff is the bad stuff. The wine, the chocolate, no good. But I either don't buy it or it's gone the first second it gets in my door. So I try not to buy it.
Bring it into the house,
Don't bring it in. Yeah. Don't bring it in.
That's good. Yeah. Well, I saw, I think it was back in when you were in a program, you did like a race, like a 5K or something like that for charity as well. Do you remember that one that you did?
That's a great pastime. Like, I think there's tons of races all over the States, I'm sure. They usually set them up 7 a.m. on a Saturday. It's perfect. So 5K run. It's actually great networking. Occasionally, a lot of healthcare organizations will run it. So, for example, I just did a run for lung cancer, for example, on Pompano Beach. It was purely for the race. I just, and wanted to do the 5K. Yet I ran into reps from Johnson & Johnson. What was the other two? Natera and I can't remember the third. But right there, I got, using my skills from your program, I was able to network right away and get my CV sent to the hiring manager. It's just out of the blue. So that's an excellent hobby to complement Yeah.
Where was that? Where was that run?
I think it was Pompano Beach. I think.
I wish we
Something
would join that one. Well, Kevin, you've shared a lot of helpful insights to us. It's just fun to, get to know a little bit more about your story and your success. And just thank you so much for joining our program, and also just joining this podcast and giving away these free tips for those out there who are wanting to get better in life. Thank you so much. You take care.
Yeah. Thank you.